Whenever you're ready.
Hello, I'm Kelsey, as you all know, and today I would like to speak with you guys about organ donation and some of the things that you should know before deciding if you want to be an organ donor or not. Everybody would like to say that they have saved a life, but by becoming an organ donor, you can say that you will save a life. There are many people out here that need organs, and not many people out here registered to donate organs. Many people wait months and years, and many people die from trying to get an organ donated to them. I am credible to speak on this topic because a lot of my friends are organ donors, and so I took the time to do a little research to see why they chose that. So today I'm going to let you guys know what organ donation is and how it works and what organs can be donated. So according to discoveryhealth.com, organ donation takes healthy organs and tissues from one person to be transplanted to another person. Brain dead, you have to be brain dead in order to be an organ donor. Even though you're brain dead, you're technically still functioning, your organs are still functioning, but you're dead, but your organs are healthy enough to transplant to somebody else. And the way that they pick a donor is that the recipient and the donor both have to match with blood types and tissue types. And they also have to not have conflicting medical history with each other in order for it to work. And normally, the transplant is the last treatment option for patients. It is a good option if they consider it, and once they consider it, they are put on what is called UNOS, which is the United Network for Organ Searching. And once they're on that list, they have an order which they go in, and the longer you're on the list, the better chance you have in getting the next organ. So, okay. Now I guess you guys want to know what organs can be donated. You can donate your heart, your kidney, your liver, pancreas, lungs, skin, bone marrow, and your cornea of your eye. Now, in order to donate your heart, lung, pancreas, or cornea, the patient has to be deceased completely. There are a few misunderstandings when it comes to organ donation as far as age requirements. Technically, anybody of any age or background can be an organ donor. But if you're under the age of 18, you have to have your parent consent for you to be an organ donor. And then people think that sometimes you're too old to be an organ donor. But some successful organ transplants have come from people in their 70s and 80s. And there have been some myths also with organ donating. One myth is that if you decide to be an organ donor, then the hospital won't work as hard to save your life, which is not true. The doctors are there to do everything they can to save you. And if they can't, then it must have been your time to go. And then there's another myth that if you are an organ donor, you can't have an open casket, which is not true. When you're in your casket, you're fully clothed anyway. And when you take a bone, if you're a bone donor, they take a rod and they place the rod where they remove the bone, so you can't tell that your bone was removed. And if you're a skin donor, they take the skin off your back, and so you're laying on your back anyway, fully clothed, so you won't be able to see it. And in conclusion, people try to make organ donating seem like it's something bad, but now that I have given you guys the top 2 things to know about organ donating, which would be what it is and how it works and what organs you can donate, I hope that you guys will at least consider being an organ donor. I personally didn't really think about it till I did research, and I thought about it like, okay, where are my organs going to do once I'm in the grave? Nothing. So why not give them to somebody who can use them and help save their life?